Welcome to Season 3 of Under the Sisterhood, Women Making the World Healthier. We'll be featuring a podcast every Friday through the end of the year. Our conversations will focus on many different aspects of health and wellness. We'll examine women's health, general health, menopause, sexual health, and reproductive health, as well as we'll dive into wellness. This is a podcast to celebrate women and all that they do in our world. I'm Elizabeth Elfenbein. Let's get under the hood. Today, we're getting under the hood of Kirthika Parmeswaran, a mother, daughter, sister, founder, CEO, and a board member of Vital Start Health, an innovative reproductive and maternity mental health company using VR from the University of Pennsylvania. Kirthika is a Wharton alum with deep expertise across business and technology. She has won numerous awards and honors, including Outstanding Leadership in Healthcare Award, DARPA Award, the ACE and MVP awards for outstanding contribution to the company's success. She is an impactful thought leader and has held key positions in R&D at Ericsson Telcordia, an Ericsson company working on product innovation, cross-functional management, sales, and strategy. Her passion for women's health stems from her own experience with postpartum depression and the clear unmet need for equitable, accessible, next generation of care across preconception, birthing, and postpartum. She feels strongly that in the age of driverless cars and ChatGPT, there is a clear need to disrupt the status quo and drive innovation into age-old challenges such as mental health and well-being. Kirthika was selected by University of Pennsylvania to lead Vital Start and has grown the venture with a stellar team, advisors, and an equitable vision of impacting millions of families. Welcome, Kirthika.
Excited to be here, Elizabeth. Thank you for this opportunity.
I'm so thrilled to be having this conversation with you. May is a chock-full nut. May is Women's Health Month, it's Mental Health Awareness Month, and it happens to be Maternal Mental Health Month. So I think it couldn't be more apt that we're having this conversation today with you and everything you're doing in maternal health. So why don't we get going?
Absolutely. My gosh, it's just the perfect timing. And I'm excited to share about the different things we're bringing to the table to really accommodate the D- rating that the US has got now in maternal mental health. The report just came out a couple of days ago.
Oh, wow. Thank you for that. That's going to be chock full of unpacking. So I think what would be great is to sort of start with your story. When I introduced you, Kirthika, I thought it was really interesting. Your background is really about business and technology. And now here you are running a maternal mental health company and wellness company. What was your journey like to get you into health and to supporting women?
Yeah, I think for this, I really have to start from the very beginning. My mother was a social worker, not with a degree or anything, but she really loved working with people, driving, self-sufficiency in villages in India where the crime rates were high. And she was a fearless lady. She really just went out of her way to help people. My father was a scientist at a leading research institution from the government of India. So I have the best of both worlds when it comes to high tech, as well as that human element, the need for that human intervention. And I think I've taken both of those and brought it to the venture that we're doing right now, Vital Start. And it's coming directly from my heart because like Einstein says, passion is everything. I'm paraphrasing here. And I think the passion is stemming from my background and from the direct experiences I've had navigating maternity, navigating postpartum, the whole journey of a woman who's, wanting to do the best in career, but wanting to be the best mom. As you know, we are everything in a nutshell, Elizabeth, and I think I can relate that with you as well. That is where I began, really. And because of that research-minded mindset, I did begin with looking at the body of evidence, forming a partnership with a phenomenal co-founder who's a physician himself, and really looking at the data that's out there, the work that's been done, and how can we bring something that can disrupt the amount of time that it takes and the monies that is needed right now, which is 19,000 and over 5 years for every woman going through perinatal mood and anxiety disorders. So we want to disrupt this completely, bring that next generation of care with that human element in the loop, because it's such a vulnerable journey. And, I think we are in a great place, and I'm looking at big things from Vital Star.
So thank you for sharing that. And yeah, no, I think Vital Start's a phenomenal company and what it's doing. But I almost want to go back a little, because in your introduction, you talked about your own personal experience, which really captured you, which in the postpartum. And so it would be great to sort of understand a little bit about your experience and like what you felt your unmet needs were, because when you're looking at creating a company, there's nothing better when you can be your own customer, if you will, creating something with yourself and designed in mind. So how did that sort of happen, Kirthika? Like, what was the journey like that got you to here from that perspective?
Yeah, Elizabeth, I mean, this is something that is really deep for me, and it has had a profound impact on my life. I lost my mother a month before I gave birth to my first child. It just threw me off. And, I had read everything. I was plugged in with all those apps. I was just, I knew everything that I could as a pregnant woman going through this journey. But that completely threw me off. And that was not something that was available, in the ether online, where how can you get over something like this? And as I grappled with that grief, because I was close to my mom, I really looked up to her, and the joy of embracing this new life in my life, in my life, and then being ambitious, what's next in my career. This was a combination, that boiling pot that was just boiling over. And I didn't see a clear view in sight. Although I had great support, I think it was the stigma. The stigma does hit you because you feel, wow, you've got everything. How is it that you're feeling this kind of stigma, not wanting to open up? Why is it you can't be assertive? Why is it you're feeling the guilt? What is this identity crisis that you're going through? And as I grappled with it, I realized that what is needed is a combination which keeps your privacy intact, and something that brings help to you, and something that is deeper than all the superficial, okay, just do a little breath work and fine, you're great for 2 hours, but what happens next? Because grief is so deep, it does not leave you really quickly, right? I literally had to do many things to get that under control. And some of that is what we want to do in Vital Start, and what I want to institute in Vital Start is not being something very superficial, but going deeper. Let's try to be in the shoes of our clients, of our patients, and really help them. The outcomes do matter. The outcomes matter. The journey matters. And so what we have done is we've built a system that's evidence-based. What that means is we're able to track, just like a Fitbit for physical health, we're now tracking how you're doing, your moods, your attitude, your journey in behavioral health and well-being through our platform. And this will be an eye-opener, just as physical health. Once you know, wow, my numbers are really bad, or I've just had 2,000 steps today or something, that does motivate you. The same way we want to motivate the clients. We want to empower both the clients and the practitioners with greater data, because practitioners today don't have that kind of data. This is not the norm. So we want to drive the best use, I should say, of technology where it is needed, but keep that human element, keep that live encounter, which your mother needs. So that's what we're trying to do.
Yeah, no, well, thank you for sharing that. And I'm really sorry to hear about your mother, but at that particular time, because I think you hit on a really good point, that added a whole other layer, Kirthika, the layer of grief added to what you're going through with trying to manage a whole new world. As a mother, as someone who, to your point of being ambitious and stuff, like what is that it looks like. And I think it's interesting as you mentioned, because that was peeling back layers and dealing with things. And you're talking about Vital Start, going deeper. And I want to talk a little bit about going deeper, the concept of going deeper, to your point of not just being breath work. And, yes, using technology, but really understanding that at the end of the day, it is our it's our end user's journey. This is their life. It's all about the process, and it's peeling back those layers and going deeper and bringing in the humanity part of that. And I think that that's, technology can do certain things. It can certainly collect data and everything, but it's that human element that really understands you. And I think that just, back to your introduction, when you said that you were looking at these phases of the maternal journey, which was getting pregnant, being pregnant, and then the postpartum, you're feeling so many different things at each stage. And, this is about being well through that. So talk a little bit about, it would be great to hear some of your personal experience in the postpartum side. So you had grief as one side of it, but how did you endure? How did you get through? And then where did you see as you've created Vital Start, there's an inflection point, and then there's suddenly you're integrating this idea with everyday life. What was that moment for you?
Yeah, that's a great question. So I just want to take go back one layer just to explain this whole concept as well. So, perinatal mood and anxiety disorders, that's just the condition, the scientific term for that condition. Let's unpack that a little, because not a lot of us know that includes trauma. A lot of moms are going through trauma across these different stages of preconception, birthing, and postpartum. We do not associate. We think, oh, soldiers that come back from Afghanistan or Iraq are having PTSD, but moms are having PTSD, going through this journey, that fear of birthing or traumatic birthing experiences, because no one really tells you everything. You have to find a lot when you're lying there and, you're giving birth. So those traumatic journeys also influence the rest of your life, the rest of your postpartum. Not only is that one piece, there is OCD, there is anxiety, there could be postpartum depression. There are so many layers here. And that's why I think women's health, maternity, going through that reproductive journey as well is something so unique. This is not weight loss. This is not what you go through, say I'm getting into college and I need some counseling. This is a much more deeper journey. And studies now, Elizabeth, and I want to share this little thing that is so fascinating to me. There is this study happening at Mount Sinai. Part of it has happened, and I think it continues. And it's represented in this book called Mom Genes. Amazing, amazing work. What they've discovered is that the baby's genes literally enter the parent's genetic code. And that's how the connection occurs. And all this, of course, they've tested with mice and so on. But that's how that connection occurs. Like you might have wondered sometimes, you have a favorite aunt. So it's not just parents, it could be your aunt, someone who has that deep connection with you. It's literally a genetic imprint on you.
Wow.
Not just the moms, but the dads as well.
Really interesting.
Yeah, so there is a multi-layer impact going through this journey, which is, not just the mind, the body, but literally your genes and the epigenetic aspect of this. What are you passing down to to your next generations? So this is that it's a really deep topic. And that's why I think part of this has to be done in a way that we look at all these nuances in this journey. And just starting from reproductive, I personally haven't gone through it, but I have enough friends who've told me about the disconnected journey, the pain involved, taking the medications, the hormonal changes that you're battling or struggling with. These are not things that are normal. Normal people go through, you might think, and nothing prepares you for this. So you do need some counseling support. I did take some counseling support, some spiritual support, because I tended to be more towards that. And I had a practice from before that helped me, and social support. I have to say, friends getting together and saying, let's do Zumba together, just something to get you out of your skin, something to get you out and feel you're whole. You're not just this one identity, but you're multiple identities with multiple purposes, living as that complete being, bringing that impact to the world.
I love that. I think that's so beautiful. And of course, it's so true. And I think that, I've been thinking a lot about this conversation because I think it's an interesting one. And a lot of me just hearing that is like, and I know I've had 3 children. And I know nothing, you can read the book, What to Expect When You're Expecting. I know the app and everything. That made me so crazy. It got me so anxious about, I almost didn't want to expect. I almost just wanted to feel. So I don't know, month 8, I might have put it down. I was because I was getting a little psychosomatic. Like I started bringing on the feelings. And in any case, long story short, I've been thinking a lot about the fact that, you don't always go in. It's hard to think proactively and with a plan to being pregnant because the feeling is so unique, and each pregnancy it's unique. And then the experience on the other side when you're giving birth, it's unique and what have you. So you really don't, you have an idea once you have your first. And I think it's really interesting because when we think about Vital Start, the potential for it to almost help in a lot of ways proactively sort of guide you through this experience where you're getting that sort of inner calm, right?
Exactly.
So how have you been thinking? So you're thinking right now, you think of the journey of, pre-conception, pregnancy, and then postpartum. How are you thinking about it? I'm sorry, I'm thinking out loud in terms of prevention versus, you're in prevention, that's proactive treatment versus reactive, which is on the other side of something happening. And how's that working for you?
Yeah, so Elizabeth, the data is out there. Close to 1 million mothers in the US, are going through perinatal mood and anxiety disorders, 20% across the world. 90% of those that go through reproductive treatments have reported depression. And here's the crazy thing. Studies are now showing that in the last 4 years, the rate of complications, pregnancy complications, not just during pregnancy, but childbirthing, has grown over 21%.
Wow.
So that's a huge jump.
And
What's happening?
Is that globally? I'm sorry, is that globally or in the US? Because that number
In the US, that number is in the US from Blue Cross Blue Shield.
Yeah, that's insane, by the way.
That is insane. We're not doing well in this area. We've got to do a lot of changes. And actually, Elizabeth, I'm going tomorrow to the NIH. Today and tomorrow, I'm presenting Vital Start and our innovation at this maternal health innovation workshop. They've invited key thought leaders, and we were invited as well for this. So I'm very excited for that. And today we're having a deeper dive to look at what are the gaps in the United States. Why aren't we able to go beyond that D that we keep getting on the report card? We're having moms dying, and it's, the 21st century. It's just crazy. How is this happening? And 40% of those going through reproductive treatments will have pregnancy complications, and 26% will have preterm births. What that means is it's not just becoming pregnant. There's so much more you're going to have to go through if you began your journey through fertility treatments, for instance. And it's not a fault. It's not anyone's fault or anything here. It's just that we need to be aware of what kind of support can we provide so that moms do not get into suicide, moms do not reach psychosis, moms do not get to postpartum depression, because this is not just impacting the mother, it's impacting the child and, through epigenetics, many more generations as well. So that's why we've taken the stance of preventative care, looking at that complete PMADS umbrella, perinatal mood and anxiety disorders, and tackling it with the best possible innovation, clinical science, compassion. I do feel strongly that we need to think of it from the shoes of the patient here, and being able to be data-driven to see what's working, what's not working, how can we make this better? That's the lens we're using at Vital Start.
Yeah, I think that's, first of all, it's fascinating. Thank you for all those statistics. I feel like I'm getting an education, but I think, it's important to educate the world. And I love the notion, like if you can prevent some of these things from occurring, or at least lessen them, you might not be able to prevent them, but if you can take it from an 8 or 9 level of anxiety down to a 3 or 4, that's manageable. That's because often, I mean, if we're just walking in the shoes of a mom or a pregnant, soon to be mom, they're doing their job. They're going to work every day, most likely, even mothers who decide to stay at home after they have children are likely working up until that point. And so they're going through managing so many aspects of their life while they're growing life within them. And that adds a level of complexity. So being able to really prevent that level of anxiety and depression, to your point, is huge. I do want to delve a little into your comment around the data. I think, just as an end, like if just as a mom, what the data would mean to me, why it's important to me as the mom is the more I know about self, like this is my everyday experience is being sort of accumulated, if you will. It's like, how do we humanize that for the end user? Like, how are you thinking about that? Because data, of course, is so important from a clinician side. But when we think about it from a mother's side, how does that matter to them?
Right. So, really, more than the stats, Elizabeth, it'll be what they're going through every day. So, we look at this from stress, anxiety, sleep, and fatigue in a very broad sense. Obviously, based on standardized mental health assessments and so on. But these are the 4 pillars that you look at, and you'll get a really good sense of what's happening in someone's life. If the fatigue is too high, could it be the lack of social support, or is it just that they're not assertive enough? And that's where you start peeling that onion and looking at what is it that they need support at? What is the help you can provide to get them to that next stage with better outcomes? So that's how we're using data. It's not really to say, oh, this is what is happening, so you should be scared or be in fear, but rather use that to your advantage. Cultivate the skills that will make you more confident, and that's what we want to do. So we provide these free toolkits to clients or any mother across the world that they can download that and look at the different items they need to be thinking of, or they should know whether they ask their OBGYN or they ask their primary care provider or just a coach or a counselor that they're working with. It's important for them to think of this holistically and look at this as a map of things they should consider, not just, oh, am I eating right? Is the baby, what's going to happen that the first suitcase or something I have to prepare. Those are all great. But then what is that overarching view you should also know? I think that's what we want to bring to the table here, is
I love
educate
that.
and illuminate.
I love that. I mean, it's so overwhelming when you get pregnant, and if your baby's unplanned. If you're planned, you might be a little more organized in terms of looking at that holistic picture of what that journey is going to be like. If it's unplanned, you're like, wow, and you have 9 months to get it together. But in the process, your body's changing, you're feeling all these different feelings separate of all the other things in your life, to your point. And I think that that's really important. I'd love to understand. So if you could tell, I mean, we're speaking to women around the world, like share a little bit about how what the Vital Start experience is like, because I think it sounds like it's really unique with the technology and the humanity part.
Yeah, absolutely, Elizabeth. So the first thing that we bring to the table is that immersiveness, that feeling that you're ready for your moment of Zen, or you are in this different world, connecting with nature, connecting with different aspect of nature, whether it's the water element, whether it's the fire element, whether it's the space element, because there are studies showing that these different aspects impact your body, your attitude, your mindset in a different way. So we want to bring that. That's the first thing. And this is about the stress reduction, the calming experiences. But we'll then use this confidence, this tools that you're using to build that depth in calming yourself and coping, to take you and prepare you to perform under anxiety. That is called stress inoculation. So that's the next piece we are bringing to the table beyond something like a Calm out there or any of these other apps, is that we're bringing the psychoeducation piece to you. So we have completed tours in the NICU, for instance, with psychoeducation inbuilt. So now you're not just seeing something dry, hospital setting, the bed looks so amazing, or here's the crib and here's how your bathroom is going to look, or whatever it is, which is what you typically see. Now we're going to look at the deeper level. What does this mean? How does it make you feel if your child is going to be separated? How does it make you feel if your child has to go through a journey? How does it make you feel if you yourself are going to go through a semi-surgery, if it has to be a C-section, or it has to be, a deeper thing that you have to go through depending on your health condition? So preparing you, making you understand, because a lot of times what we have realized is things we don't understand, we start putting our previous patterns or self-limiting beliefs to it.
Mhm.
Oh wow, this is all because of me, my body's not ready, so you start feeling guilt. Or like infertility, we hear that a lot. Wow, my eggs do not, not enough eggs were retrieved. That's because I'm not good enough. That's sort of an association. As
Mm.
women, I think we tend to jump into all these things even faster, it feels like. So that's why that education helps to know that it's not just you, it's the procedure, it's the way things are done, it's the timing, it's the way the medication worked. And, there's so many factors. So, really understanding the factors, preparing you for the journey, and making you realize that you're not alone. You're not alone in this. You've
Mm.
got a coach, you've got someone who's going to be with you through this. And that's something I think we all need, especially coming out of COVID. That social connection or having someone with you is really key.
I love that. And it's interesting, Kirthika, in season 2, I interviewed, we dropped an episode with a doula and
Mm.
talked about, the stages. She does get earlier in, usually after someone's pregnant. So it's not in the earlier parts. But I think what was really interesting is she's kind of like a coach, dare I say it, Ildi, I'm sorry, but she coaches the family who's going through the experience. And I think what I noticed with Vital Start is you have two different levels. So you have a coach and then you have a psychotherapist. Talk about how you look at it and how you branch out. But I think it's brilliant because everybody needs that guide who's going to be there with you, in it with you. You're not alone. You're dealing with something, and they probably likely have been through the experience or certainly have been trained as such.
Exactly. So you do need that cheerleader sort of helping you, right, through all the ups and downs of this journey. So that's a great point, Elizabeth. And this is, again, coming back to science. Typically, when you look at mental health assessments, there's a threshold. So if you cross that certain threshold, that means you're more susceptible. You have a higher risk for postpartum depression, or you have a higher risk for another aspect of this journey. So looking at that, we have come up with 3 aspects to this service. One is a coaching service, which
Mhm.
means yes, you're on the border. You are a little susceptible, but you can handle this. So just having a cheerleader, a coach would be great for you. Or in instances where you need to do a self-pay model, where your insurance may not be covering this, or you fall under the health equity aspect where you can't afford all of this at that rate, then we have the self-pay model with coaching, 2 encounters per month. The other model, which is going a little deeper, more involved, is when you have a licensed psychotherapist working with you. And that's when you've had some pre existing issues, whether from a previous pregnancy or something else, trauma from your childhood or other things that are inhibiting your joy in this journey. So that's what the psychotherapist would be doing, is working with you on some of those obstacles. And you'll still have a coach with you, cheerleading, motivating you, helping you get through the different curriculum, the different aspects of the curriculum, whether it's the content that we provide, the toolkits we provide, the mental health assessment tools. We want to have this cheerleader making sure that you're taking advantage of all those things on your own, at your own privacy, being able to emote and being able to go deeper. So that's the other aspect. And the third is the self-guided care, Elizabeth, which is not something we're launching right away, but we will do that, maybe 2 years in, say with a hospital system who already has doulas, or a state level entity that has doulas, that has the practitioners, and all they need is the content and the platform. So that would be the offering for them. So those are the 3 types of offerings we have.
Mm. Well, just looking back, and I have adult children now, but it would have been so nice to have had someone who was in the corner with me, who's that third party. And when I say third party, it sounds disconnected. I'm just saying, not with your mom's slant, just someone who's there for me with nothing other than to take me on this journey and let me know it's going to be okay. That what I'm feeling is, it's normal in the process of all the things that my body are going through, because it's really scary when you don't have that. So I think it's a wonderful offering. And what I love about it as well is just the fact that you can go into a pregnancy in a very prevention mode, which is really keeping you in a positive space. Because I think everything in life, if you can attack it from a positive versus reacting to it, you're in a much better frame of mind. I mean, delivery is going to be difficult. There's no good, I mean, there are easier deliveries than harder deliveries for sure, but delivery is hard. And so if you can keep a pregnant soon to be mother calm, if during even the journey to with IVF, like going through fertility treatment, if you can keep the mother and partners and if the family's calm in the process, it's more likely that things will take. If they're very stressed out and they're running around, it doesn't matter what it is in life, we know it won't work. So I mean,
Exactly.
bringing this element, I love this immersive, the immersive nature of really that soothing. In a way, it's like Vital Start is becoming sort of the mother to the mother, if you will, by providing this sense of embrace and love through a process, which, by the way, is a beautiful process. It's just there's so many layers to the process. It's not a simple process. It's not a simple journey.
I love that, Elizabeth. Mother to a
That was
mother,
an
and
accident.
with Mother's Day coming, that feels really
Mm,
amazing. I hear you. Yes,
yeah.
that's the goal, to be your favorite aunt or your mom to whom you go to for advice. But here we're giving you the ability to have your privacy, to get over any of your inhibitions. And like you said, when you have a third party or someone who comes at it from a different viewpoint, right? They don't know your past, they don't know what you're really about. All they care is that journey you're on and to get you to that end step. I think that really adds everything. And this day of Chat GPT, Elizabeth, I want to say I've been following some fascinating TED Talks on how they're using Chat GPT in education. I do see that, this is where the technology can evolve. We can get some things from technology for sure, but I think the human element, at least in maternity, in reproductive health, is required, and it'll make a great combination. It's like having a tutor, but having an AI chatbot, getting you a little closer to what the tutor really wants to do is take you to that next league. So that's kind of the combination we want to bring to the table too.
I think that's an interesting analog. I have mixed feelings. So I love technology.
Mm.
So I think that it provides so much value used in the right way, in the right context for whatever the need may be. That being said, I do think when you are going through any condition, but let's speak about maternal health, anything related to maternal health, it is a feeling experience. It is not something that Chat GDP feels. It doesn't understand that because it's technology. It's AI. It's not feeling the experience. And I think that is where, and that's why I believe you're onto something, because you can bring the immersive content to play, but it's the connected nature of the humanity, the guided coaching, the person who's there with you on the journey, supporting you so you're not alone, that is feeling it with you, that I think is going to make the difference. I mean,
Yeah.
I have been like, I've written articles about, feeling experiences, the fact that, it's more than it is about walking in the shoes of your customer, or in this case, the mom, but it's also understanding that it's a feeling experience, and it can be a physical feeling. It can be a mental feeling. It can be a spiritual feeling. You're combining all these aspects together as you are either trying to conceive, you're pregnant, and so your body's going through regardless of what stage you're in, you're going through so much hormonal shift, even
Oh
if
yeah.
you conceive and going through IVF. So for me, I think it will be a while before. Listen, I have not done studies on this. You're probably much more versed, but I just wonder if that's an area where Vital Start is a little more cutting edge potentially, because it understands the need for the humanity side. You just can't go straight to technology, because the technology is not going to mirror what a mom feels. Do you know what I mean?
I agree completely, Elizabeth. And I think it's finding the right place for certain things, right? Everything doesn't work everywhere, and you have to experiment and check this out. And we started that way. We started even with gamification because VR is great for gaming, and it just would not work. It just did not work. And so I'm very confident that this area that we are targeted and we are focused on requires that hybrid approach, requires much more of that emotional connection, the deeper connection. that moms need, moms and really LGBTQIA, any caregiver or any parent needs going through this journey. And we are here with them every step of the way. That's the goal of Vital Start, to be able to deliver that joy and be with you every step of the way.
I love that. I mean, it's just it's so beautiful. And it's a really, I mean, this is a very beautiful time, even trying to conceive and going through it. Is how do you find, and I think I had mentioned to you in our prep call that I had conversation with Dr. Laura Gemmel, who is she's an OBGY resident at Columbia Presbyterian, but she's going into REI for her specialty. So her she's finishing up her residency. Anyway, long story short, she will be focusing on IVF, and she talks about the fact that this is while it's so hard, she says she has never seen a more resilient community of people with what they're going through. And so I think that back to the comment, I know it might feel a little left field, I'm going to bring it back and it will make sense. Back to the comment about the hybrid model. I almost, I as just a human want to say, I just feel like humanity meeting technology. This is making health tech human, which I've said before for another client, by humanizing it, by bringing in the human element. I think that it's going to be so helpful to women, because while they'll want the other sides of it and they can do some of that, having that experience with someone walking them through and being there for them every step of the way is just going to be amazing.
Yes, here.
So this has been
you put it in a nutshell.
Is there anything else that you want to talk about with regards to maternal health? I mean, it is Maternal Mental Health Month, Awareness Month.
Yes.
Anything else you want to share on that, Kirthika?
Yeah, thank you for that, Elizabeth, for giving that opportunity. This Saturday, I believe I've been following this online. The report card came out for United States on how we are doing in maternal mental health. And we got that D. And I think there was one state that got a C. But for most of the things that they look at, being able to provide support, whether it's through reimbursements or being able to provide screening help, social support, we've done miserably. And it's so fascinating because every time I feel as if, even in the previous Recovery Act, I think there were bills talking about maternal health, providing support. There's this Momnibus bill that's happening. Some of it has come for veterans, hasn't come for other mothers. So there's definitely that linkage that we're missing, that the dots are not connecting completely. That's my sense. And this is the kind of thing we're going to be discussing at the NIH workshops as well, is what are these gaps that we need to overcome to have that complete, picture, to complete the story? How long can we just keep talking about this? Definitely there is that health equity aspect. So I think this, Elizabeth, and a lot of us, maybe your viewers, it might be eye-opening for them, but your zip code decides the kind of health services you get a lot of times.
Oh my God. I don't like that. That doesn't sound very nice.
Yeah, it is not very nice. And this is all public knowledge out there. So there is a thing known as the SVI index, Social Vulnerability Index, from the CDC. You put in your zip code and you will see what are the key health issues in these areas, in the areas you're in.
Wow.
And a lot of times what's happening is moms, especially maybe those with substance abuse issues or moms with babies out of the NICU, 1/3 of them are going into areas they can't afford to take care of this infant or to take care of themselves on their own. They need support. They need support from their state. They need support from their communities. They need support from, at the federal level in terms of reimbursements, in terms of continued help. So that's one end we're seeing, which is something we really are passionate about at Vital Start. We are working with VR, but we've begun with mobile VR so that it can be affordable. It can be more accessible to every mother in the US and hopefully later across the world, because we are looking at this from that global view of having an impact on those million families in a decade from now. That is one key point. I know that itself is a mic drop moment for me here. But the other area which I feel very passionate about is, of course, the research. We know that a lot of clinical trials do not include women. A lot of medications, a lot of approaches are not women-centered. I think that has to change. We have to be able to drive our research, our science to that next level to be more inclusive and to be more aware of not just the gender, but definitely the race, all these newer gender definitions that we have as well. So I think there's a lot of work to be done, but I'm excited that Vital Start is part of this process and we want to make that impact and really help all the mothers, all the parents going through this journey together.
That's wonderful. This conversation has been amazing and I love what you're doing at Vital Start. I have one last question, which is an overarching question. So this is taking a step back and looking at Kirthika as a mom, as a woman, not as the CEO of Vital Start. You're giving a message to women out there around the world, and it can be around maternal health, but it could be bigger. It could be health at large or what have you. What would the message be that you'd want to give to women around the world right now?
This is a fascinating thing because, I have 3 daughters and I see this in different ways almost every day. And my message and my cry literally to all women is let's be in our power. We lose our power too often, whether it is to life situations, whether it is to our identities as a sister, as a mother, as a daughter. We need to be in our power. We need to be completely in our power without having to always be too nice or without having, it doesn't mean you become a mean person. I'm not advocating that by any means. What I mean is be authentic, be in your true power, and rise above. There is no glass ceiling in my view. Don't keep all these limitations. Let's be limitless as we're meant to be. I think I want to stop there. Limitless is my word.
Oh, I love that. I love limitless, but I love be in your power. Women, be in your power. And, Kirthika, I have 2 daughters. I have 3 children, but 2 daughters. And, if we can teach our daughters that, and as I said, mine are adult daughters, which I think my daughters are in their power, which I am so proud of. They're both in their power. And I know that yours are growing up and they're growing into their power. But if we can teach that, we can role model that as women, in whatever capacity. I think that's amazing. I think that's a wonderful message. Wow.
Thank you so much, Elizabeth. This has been lovely.
Just awesome. Thank you so much. And happy Maternal Mental Health Awareness Month. Thank you for all that you're doing with Vital Start.
Thank you so much. Thank you, Elizabeth.
Thanks for listening to Under the Sisterhood. If you haven't already, please give us a quick rating and review on Apple or Spotify. And make sure to follow us on Instagram, Facebook, and Twitter so you can hear from more amazing women. This podcast is created and hosted by Under the Sisterhood, LLC, and Elizabeth Elfenbein, produced by Elizabeth Elfenbein and Zach Slaff, and edited by Zach Slaff. The music is by Ayla Schaefer, her song, Rose.